Hello, everyone, and welcome to another episode of Beyond the Script. We're here again at Montgomery Heart Wellness. We posted this show just this morning, so many of you may have just seen it. But it's a very special show today. This is going to be part of a series of shows that I will do, and it's going to be titled The Food Prescription for Better Health series. And I'll be using some of information and clinical stories from our patients. In fact, I had a guest on today. I think she lost connection, and I hope she'll come back into the chat room. But I want to talk about a patient who presented to us a week ago who had complaints of long-standing arthritis, hypertension, high cholesterol, and pre-diabetes. And I want to share the initial presentation of her story, and I have some slides I'm going to share with you that I think is going to help us make the story. And she was actually on early, and I hope she comes back into the chat room. But this patient came in a week ago, actually, and chief complaint was joint pain, shortness of breath, and fatigue. She had a clinical history of generalized pain, especially in the lower extremities. She had had two hip replacements, so two chronic hip surgeries, chronic hip arthritis, and two hip surgeries. She also had severe pain in the neck and the shoulders. She also had generalized fatigue, stated that she had been on steroids, and the steroids had contributed to her weight gain. She denied a history of hypertension, and she also denied a history of diabetes, but did have a history of high cholesterol. And so she essentially came in, she didn't have any acute cardiac symptoms, but basically said, look, I'm hurting all over. I'm tired. I'm on a lot of medications, and I really need your help. And we hear this kind of story a lot. So on the first evaluation, her vital signs, the blood pressure was 172/65, heart rate was 66, and her weight was 246 pounds. She was on a long list of medications and supplements. I'm not going to read them out to you, but here's the list. There was 12. And so these were all the things that she was taking to treat her condition of arthritis and pain and the like. So this is what we were dealing with. Now, baseline metabolic panel, we drew blood, and this was the finding. Blood sugar was 104, a little bit high. Blood urine nitrogen was a little bit 27. I'll explain some of these labs to you. This is related to kidney function indirectly. The creatinine was 1.1. That's also related to kidney function. That was a little bit high, and we'll talk about that a little bit. And the glomerular filtration rate, that's the rate in which the kidneys filter the blood. And here she goes. She's back in the studio now. Welcome back, Ms. Hardy.
Thank you.
I'm just going through some of the labs, and I'm gonna get to our star in just a minute. So we had the cholesterol was 290. That's the total cholesterol. Triglycerides were 366. HDL was 62. LDL 166. And the ratio was 4.7. The insulin levels were elevated. C-peptide was elevated. And insulin resistance score was elevated. I'm going to explain these labs later. But I wanted to give you, our audience, insight into what we saw in terms of the clinical information with Ms. Hardy. So welcome back, Ms. Hardy. I know we had a little bit of technical difficulties there. I'm glad you got it solved and you came back. So what I shared with the audience, Ms. Hardy, is the overall clinical picture, what our assessment was of what you were dealing with when you came to see us. But let us hear from you. So as I typically ask my patients when they come, and I go into the exam room and said, well, what brings you here today? So Ms. Hardy, what brought you to Montgomery Heart Wellness, and what led you to come and see us when you did a little over a week and a half ago?
Well, I was living with chronic pain for approximately a year and a half, since January the 4th of 2019. At that time, I had had a second hip replacement on the left side of my body due to metal going through my bloodstream. And from that, when they put me in the hospital for the surgery, they fractured my femur. And so when I went to rehab, they did the wrong therapy. And I had to go on complete bed rest. But from that, my right side of my waist or my back on the right side was in severe pain, to where when I tried to stand up for more than 4 or 5 minutes, it started tightening up to the point that I would have to sit down, and I was in debilitating pain. They put me through pain management, and what happened was they did 4 procedures on my back, which if you're having back problems, you know what I'm talking about. And when they did those 4 procedures, I was still in pain. So what they likened me to, when they brought me in finally and told me, they likened me to a 55 Mustang, and my parts had worn out, and that I was just going to need to stay on the hydrocodone, which I did not want to do. That was not an option. So I began to pray about it. And what happened was I went to Bible study. And when I went to Bible study, one of our leaders was telling us about how he had had cancer 4 years ago and was given up to die. The doctor sent him home to die. And he was in his final stages. And he went to Dr. Baxter, Montgomery. And what happened was he's still living, and he is the picture of health. His face, his skin, everything was beautiful. And so I felt like that I went to that Bible study, and that the main reason for it being there tonight was for me to hear his testimony. Therefore, I got on board and I investigated Dr. Montgomery and decided that I wanted to make a commitment to see if I couldn't change my life and turn it around. In addition to that, for 4 or 5 months before I came to Dr. Baxter, I was coming to him earlier, but because of the pandemic and uproar, I didn't get there until a week ago. And I was having on the left side severe pain that woke me up, like my hand going to sleep, and my fingers would be swollen, and I'd have to raise them above my head in the middle of the night and put a heating pad and put a pillow under it, a rolled pillow. And I was having all of these problems. And so weakness in the legs, I couldn't get out of the bed and stand. I was afraid of falling. And I would have to hold with a cane and onto the furniture just to get to the bathroom in the morning to get started. Severe stiffness in my legs and lower extremities. So with all of this, I hadn't been able to walk my little dog for a year and a half. My neighbors had been doing it. And I was tired of this. I was really tired. I'd had enough. So when I went on the program and went in and they did the assessment and everything, they told me about the food plan that they wanted me to use. And it was a raw food diet. Well, 76 years old, grew up in grandma's kitchen. You know what we ate: fried chicken. You know the words, chitlins. So you know what I'm talking about. Okay, the big Grady's and all that. You know what I'm talking about, and the sugar and the cakes and the pies and all this. Well, I knew how to. Not only did I know how to eat it good, but I also knew how to cook it good. So I didn't know anything about this raw food diet. That was completely alien to me. And so when they offered me the option to purchase the food plan for a 28-day period, detox period, I made the investment. It would cost because they have to prepare the food for a month. But I went ahead and made that commitment because the only way I was going to get into this and do it effectively was to go ahead and do things that were alien to me. And so prepare food in ways that were alien to me. And so I got into the food plan. I embraced it. My motto is that I am not living to eat anymore. I am eating to live a healthy, pain-free, and productive life. Able to work, to go and do the things. I like to travel. And so I haven't been able to travel. Thank God I didn't travel. I wanted to take a cruise in December and January, but I'm glad I didn't because of the pandemic. But I'm on the plan. I like it. The food is delicious. It is different, but it's not bad at all. So I'm enjoying. It's not. It's really not bad at all. You know, we get tired of eating the same old things all the time. Well, I'm eating new different things now, and
Wow.
I'm trying out new things, and I'm embracing it.
Wow.
So I think.
Go ahead. No, go ahead.
Go ahead.
No, so I was going to ask you how you enjoyed the food. So you answered that question. So it's different, but it's not hard to eat. Is that correct? Is it okay? Or have you had any cravings? Had you had any cravings for some of your old favorites?
None. I've had none. No, not any. The only thing I think that I was concerned about, I always had a diet pop with dinner. I never could drink the whole thing, but I always liked the taste to finish off my food. And now the primary drink that I was on this detox, this first week that I was on it, I was drinking water, just good filtered water. And I went into, and let me just say this, his staff, the people in the kitchen are very helpful. If you express a concern or a desire to them about something that you're missing, they will let you know about the options that can be used in place of what you've been doing. So when I went in and I told her, I said, well, what do you all do for something to drink? I said, when I eat my dinner, I don't have anything to drink. And the young lady, she says, what we do is we make the drink. And she told me about the strawberry drink that they make, though they blend them. And if you decide to go, you'll learn more about that. I'm not going to go into it. But the point is, she even went to the ice box and she gave me one. And she said, here, try it. Mm-hmm. It was delicious.
Yep. And the cold pressed ginger juice, if I'll mention, also helps with digestion. So a lot of the beverages that they make in the nutrition center, it's not only that they're delicious and tasty, but the food that's designed in the nutrition center has a purpose. Not only the purpose of satisfying your palate in a sense of enjoying the food, which I'm glad you enjoyed it, but it also has a purpose in terms of your health and reducing inflammation. Tell us what happened to your arm. You mentioned that you had severe pain and numbness in that left arm. What happened?
That left arm was driving me insane. My primary care physician wanted to do x-rays on it, felt like I had a pinched nerve, but we hadn't quite gotten to where I had the appointment to go. I wanted to get Dr. Montgomery's program in place. That was my primary first goal, was to go ahead and get enrolled in this and see, get it started. And so guess what? Started the diet. About 3 days into the diet, I woke up, no pain in the shoulder, no swollen fingers, no radiation down that left arm. And I don't know why. All I can tell you is it went completely away. And I'm still not having any problem. I was afraid to go to sleep at night. I said, I know my rest is going to be broken and I'm not going to be able to have a peaceful night's sleep. And I'd be tired sometime. But I'm not having any problems. I feel 1,000 times better. I really do.
And that's after a week and a half. And the issue with the pinched nerve, I think your primary care physician was correct. You probably did have some kind of a nerve impingement. And we see this a lot with arthritis. You may have some inflammation in the vertebral bones in the neck or upper back. And these nerves that come out of there can be pinched or irritated, if you will. And oftentimes that's due to inflammation. And what we see when someone starts on the nutritional detox, inflammation goes down very significantly. And you can see a reduction in inflammation in the first week. And so when I sat with you on the second visit, as I shared with you in the studio before we had a chance to come on live, I didn't realize you had started the meal plan. I remember we saw you, we talked about it. And again, you had talked to my nutritionist, but I wasn't aware that you had started already. So you were telling me all of these changes. And so, well, wait a minute. Wow, this is amazing. And he said, oh, yeah.
think it was amazing. I
Yeah.
didn't think it was amazing because the wife of the gentleman who told me about the diet, they're both on it. I don't really call it a diet. Let's change that. A new way of eating.
Yep.
Let's just call it what it is.
There you
It's
go.
a new beginning, and it's going into another phase of your life and eating correctly. And she told me, she says, Nawita, she says, and this is not going to take a long process. She says, if you get started on this program, you're going to see results immediately. So when Dr. Baxter Montgomery was floored about it, I wasn't, because she had already told me. I knew that I was going to feel better immediately. They do tell you that you can have sea salt. I haven't had any. I have just stuck strictly to the diet. I have not tried to buy any smoothie kits that are in the frozen sections. I'm only sticking to what they told me, and that's the fresh fruit and vegetable. That's all I'm doing. I'm following. And so it's important that if you're going to see results, I think you're going to have to be obedient and follow the plan, because they know what they're doing, and it's all new to us.
And let me share some more information with our audience, Ms. Hardy. We, as you and I talked before coming on, we talked about some of the lab data. I'm going to come back to this slide in a minute, but I'm just going to show you some of the bar graphs. So basically, in summary, what as Ms. Hardy shared with us, she had more mobility, less pain in the arm, the hip, and more energy. Her systolic blood pressure went down by 30 points, from 172 to 142. Diastolic blood pressure went down by 3 points, and weight went down by 11 pounds, all within a week. Now, the thing is that we typically see these kind of changes, and a lot of this is due to inflammation, and this is without any addition of medications. However, because she was feeling better, what we did, and this is part of the treatment. Now, this slide says treatment, and I want to emphasize treatment because part of the treatment is the discontinuation of medications. So we look at part of our treatment to discontinue medication as opposed to always adding medications, and that's really important. So if you look here, we stop hydrocodone, and I say medication, we stop the prescription and also a lot of the supplements. Many supplements have carrier molecules that may not be optimal, and we use supplements, but only in a targeted fashion. So what we did is we stopped a lot of supplements and various things that we thought that could be safely stopped. Now, we do this under close observation. We see, like with Ms. Hardy, we see all of our patients within 1 week, but the discontinuation of medications can also contribute to the improvement of health. But you have to start with the nutrition, as Ms. Hardy said, a new way of eating. And then with this new way of eating, the body starts to correct itself, it starts to heal itself, and it gives us the opportunity to make the kind of changes and the things that we like to make. I want to go back to these labs. Now, one thing, and I shared this with Ms. Hardy in the conversation I had before coming on, but she was not diagnosed with diabetes, but told that her blood sugar had been high. And we found the same thing. The glucose is 104. And if you look at the insulin level, we see insulin is high and the C-peptide is high. Now, people in the audience may not be aware of this, but her pancreas was making a lot of insulin. And so had to make a lot of insulin to keep it had to make a lot of insulin. I just put you on mute temporarily. I think your dog may be doing some things. It puts you on the pancreas creates a lot of insulin to keep the blood sugar down. And you see her insulin level is high, but the blood sugar level is still coming up. And this is classically what we see in insulin resistance, an elevation of insulin production, but the glucose is still high. That means her body's not responding to insulin properly. So what we're going to see with this nutritional cleansing is that insulin resistance is going to go down. So we're going to repeat these labs over time. And in a follow-up, we'll share with you what the changes are. One other thing I want to point out, the cholesterol is high, as we mentioned earlier, and the LDL cholesterol is high. And we anticipate that these numbers will improve in the next 4 to 6 weeks. The triglyceride to HDL ratio is very high, And that's another sign of insulin resistance. And so we really want to point out that these are the baseline findings. There's some mild dysfunction in the kidneys. And these are all the things that we typically see in individuals who have diabetes or early diabetes. So the key is that we have a baseline set of findings. We're going to follow her clinically. We're going to follow the labs, and we're going to make adjustments in her clinical care as well as the medications and the like over time. We're going to monitor to make sure the blood pressure doesn't drop too much. We left some blood pressure medications on, so we have to monitor the blood pressure as well. Some patients' blood pressure drop pretty rapidly. We have to make rapid changes. So these are some of the things that we do and some of the changes that we make. So, Ms. Hardy,
Yes.
I really want to thank you for coming and giving such a wonderful story. We're still on your journey, and I wanted to give the early part of the journey. I hope you'll come back and enlighten our audience with the journey. The journey is not always smooth sailing. There's some rocky parts of it. And so we'll be willing to share those things with you. But before we go off, any parting words for the audience, for our listeners, any words of encouragement or the like?
I'd just like to say that if you want to have a productive life, and we all do. And so if you want to live your life to the fullest, instead of sitting in a chair in chronic pain on loads of medications, this is definitely the way to go. It's enriching my life so much, and it can also enrich yours.
Wonderful. I couldn't have said it better myself. And thank you very much, Ms. Hardy. And I want to, invite you back on perhaps in another 3 weeks. We'll see how it goes toward the end of the boot camp, and we'll share the victories and struggles together, and we'll share them with the audience. I really appreciate you coming and telling your story, because it's really meaningful for our audience to hear this. So until next time, thank you very much. And I'll be seeing you in the clinic as well.
Thank you for having me.
You have a good day.
You too. Thank you.
Uh-huh.